All right, so just out of, since it's going to be such a great talk, I want to make sure we have lots of time. So I'm going to begin just by a couple minutes of introduction around our program in the Colorado Clinical and Translational Sciences Institute. And so as people come in, they can just hear an overview about our program. So I'm going to start off with who we are. So the Colorado Clinical and Translational Sciences Institute, what we all call CCTSI, it's a grant-funded group within the University of Colorado system. And what we do is we build the research teams of the future. We speed the development of new treatments and we improve human health. CCTSI, it's a multi-institutional program that includes 4 campuses, University of Colorado Anschutz, CU Denver, CU Boulder, and Colorado State University. We have 6 affiliate hospitals and healthcare organizations. We have 6 health professional schools and 20 community organizations. CCTSI was launched in 2008, and we are funded by a NIH CTSA grant, which is the Clinical Translational Sciences grant, and have substantial support from our university and partner hospitals. Membership within CCTSI is free and provides access to resources, including consultations, regulatory support, education, training, and pilot grant funds. And so if you're interested in joining, information is on the slide, or you can scan the QR code. So one of the things the CCTSI group offers is some consultation services, and because of our specialty core. So I am part of the Dissemination and Implementation Science Research Core, and we support innovation, education, and application of D&I science and evidence for the CCTSI community and the broader clinical translational community. We offer support in 3 areas. We offer science resources, educational opportunities, mentorship, and then consultation and collaboration. And we partner with the group out of the School of Medicine, the Accords group, which is led by Dr. Russ Klaskow. So we have lots of amazing experts here. And here are just a couple of them. We are led by Dr. Bethany Kwan, myself, and Dr. McNeil are the associate directors. And then we have communication experts, including Dr. Reno, Robert Thompson, and Justin Schrader. So we encourage you to tap into our knowledge base through our CCTSI dissemination consultation service. And this is a free program. So if you're interested in what Dr. Southwell is talking about and you're thinking, I want to engage in this, we can help you on an individual level, work on your research, figure out how to do press releases, how to message your stuff for videos or podcasts, and then also develop a evidence-based dissemination plan. So we've had a couple speakers already this year. We had Dr. Andy Hoffman from University of Michigan, who talked about becoming an engaged scholar. And then later this summer, we will be having the Colorado Pragmatic Research and Health Conference, which we encourage you all to attend. And we'll be talking about disseminating, scaling, and sustaining pragmatic research. And again, attendance is free, and you can sign up here on the scan link. And so without further ado, I would like to introduce Dr. Brian Southwell, and he is the Senior Director of the Science in the Public Sphere program in RTI International Center for Communication Science. RTI International is an independent nonprofit research institute dedicated to improving the human condition. Dr. Southwell attended the University of Virginia and University of Pennsylvania, where he earned a PhD in communication. And he has earned many research and academic accolades and is also the host of a public radio show, which you can hear on WNCU in the Durham, North Carolina area, which I'm sure he will mention. But I'm going to relinquish the slides and let Dr. Southwell take it over.
Great. So thanks so much, Heather. I really appreciate the chance to talk to you all. I've been looking forward to this particular discussion. I give a lot of talks, but this one is really near and dear to my heart for a variety of reasons, not least of which is that Heather and her group have really built an organization that does in practice some of what we'll talk about here today. And I do think that these are important, crucial functions that we're going to talk about in terms of building bridges to different communities. And it doesn't happen overnight. You can't just snap your fingers. It takes work and infrastructure and skills. But at the same time, this is all work that I think everybody on the line today can contribute to. And so I really appreciate putting a spotlight on this particular theme. And my hope is today that I'm going to start a conversation. It'll probably be one that we might have interest in continuing, further, and so I'll open the door for that as well. I'm going to go ahead and share my screen here. Should be all set there. And Heather, let me just confirm, just a thumbs up you can see. Great, okay. So again, I really appreciate this chance. It's a really wide-ranging network that you all constitute here, and so people likely with a variety of different backgrounds. But I think there are some common themes. All of us that are working on research projects that ought to see the light of day in terms of public discourse, and sometimes don't. There are good reasons for that, and there's a lot of considerations that I think we can raise here. So I want to try to do that throughout our time. I do have some remarks that I want to offer, but at the same time, I am going to leave room for us to have a discussion. I'm really interested in knowing what some of the experiences are that you all have had, and I'll look forward to talking about all of that. So the first question that I want to ask is one that I suspect most of you on the line could speak at length about. And at the same time, it's a question that I want you to think about your own answer to, but I also want you to consider from the standpoint of audiences who work far outside the institutions where you work. What are the ways in which people might answer that question? People without advanced degrees, people that are not actively working on this research. And that's really at the core of what I want to emphasize here today, is thinking about how it is that various audiences conceptualize the work that we do or don't at all, and what we might do about that. That's a really important starting position. And the truth is, from a popular culture standpoint, we, in many cases, people might either have sort of an abstract or blank notion, or perhaps they have just a sense of research, scientific research in some way that hasn't really changed that much in decades, and it may or may not line up with what we know is happening now, but nonetheless, this is a reality that I think we really absolutely need to face, and we have to be prepared to engage with the mental models, the mental conceptualizations people have of the work that we do, if we're going to attempt to translate and think about implications from that work. So something that I like to emphasize here, and I think it's important for us, is to recognize the human opportunity and the human limitations of the audiences that we are going to be addressing and working with. And if we know anything, it's that we're not typically dealing with what we might think of as a blank slate. That there is a tremendous amount of lived experience that people bring to bear. That there are constraints of the human brain, sort of in general, of course, and opportunities, but there also is a lot that has been socialized, that people have had lots of experiences, which they might bring to bear in trying to make sense of what it is that you're saying when you're talking about your work. That previous experience may well have a lot to say, or may well be an important force in terms of the media content that people are currently engaged with. And so something also that I think is crucial is for us to be optimistic about possibilities for the future and for future engagement, and not to necessarily assume that just because audiences have not shown any interest previously, that that's not going to be possible, because at times the media diet of various populations of various audiences is driven by what's come before, but it doesn't mean that you can't find ways to creatively frame work to make it relevant and to open up new possibilities. At the end of the day, I just want to emphasize this notion of a mental model, and by that, all that I mean is the mental representation that you or I might have with regards to a particular concept, and you can apply this to a variety of ways of thinking about the world. But I thought I would offer an example here that's outside the realm of what you're typically dealing with in your own research, just to make the point that we can and need to pay attention to the variance that exists for various audiences in their mental models. So I want to ask you this question about a house. What is a house? And as soon as I ask that, I suspect something comes to mind. For you, it might be a couple of words, it might be some ideas. If I were to ask you if you had a piece of paper, and a pen, nearby, you could sketch something right now. And that would be interesting to see. What would come to mind for all people. For some of us with maybe limited artistic ability or limited time or interest or a sense of this, what we might sketch out would be just a simple representation, and that's fine. That might work just fine for getting us through the day, and for lots of different kinds of conversations. For others, though, something more complex is going to come to mind, and you might have a lot more detail, a lot of different dimensions, and this might be very different, than what came to mind for you when I first asked that question, or this might be exactly the kind of architectural schematic that that would come to mind. My point in raising this is that when we talk about research, people are dealing with different levels of complexity and abstraction, and we've got to find ways to approach and address that from a standpoint of respect, but also to recognize that that really does constrain, the kinds of engaged conversation that we can have. And I want us to think about the translation of our research in terms of conversations, rather than just simple presentations that we're putting out into the world. These mental models really do constrain people's behavior. They do constrain, it's possible to be talking with an audience about a concept, and yet for them to be on such a different plane that they're going to miss key and important pieces. An example of this has come up recently in the context of the infectious diseases that we've had, unfortunately, tremendous amount of new experiences with. A few years ago, the infectious disease of the moment was Zika virus. And we did some work on Zika virus in a context in Guatemala where there had been a tremendous amount of mosquito-borne disease, dengue and chikungunya, for example, historically. So the idea of a virus that was spread by mosquitoes was actually not altogether new. And something interesting that we found was that maybe perhaps a little bit differently than was the case for other countries and contexts. In Guatemala, people would actually nod somewhat knowingly, or they would talk about Zika virus, but it was clear that they were thinking about Zika virus as yet another mosquito-borne disease. And so that's what this was. Now, there's a twist. For many of you, will be familiar with the idea that Zika virus has a couple of routes of transmission. And for many of these audiences, the fact that Zika virus could be sexually transmitted was not even on their radar. This was not, because it wasn't part of the mental conceptualization they have of how these diseases worked. And that has a lot of implication, of course, for prevention. And so that's something here that you have an audience. This is not an audience that has no sense of this. This is an audience that actually thought they had quite a bit of a sense of what Zika virus was, but actually was missing a key part of this because they were so informed by the previous mosquito-borne disease. I think we see some of this actually unfold in the early days of the pandemic as well, in which you've got people using language and using metaphors to talk about COVID-19 that are really not appropriate. People that are in the early days talking about this as, just another, flu, for example, and missing key dimensions of what's novel here. And so that's, I think, a good reason to both be empathetic for some of the confusion that people had, but also to recognize that the starting position of your audience, it really does matter. So when we talk about the research that we are attempting to translate, what information do we have about where people are coming from to begin with? Where is the starting position? What's the existing mental model of this? And that should inform everything from your press release to your preparation for an interview to your thinking about your public engagement and community engagement on this particular topic. So we can ask the question about clinical research as it exists in our heads, but we also need to ask that question about what it is to general publics, importantly to journalists who are going to be an important player in the role of translation, and even to other researchers outside of the fields and areas where we're working, as we think about negotiation of resources for this kind of work with other kinds of stakeholders. So here, I'm going to ask you to consider the types of roles that you actually might be in a position to play. And this is a question that I like to ask because it invites some imagination on your part. And I suspect that many of you have been drafted into some of these roles, but I think there's also an opportunity for you to proactively seek out some of these. And there are a wide range of ways in which you might actually contribute here. You might be quoted in a news story, and that may or may not have been a good experience for some of you that have done this previously. But there are also instances where you can proactively attempt to engage with social media or in a blog, to write about and to translate some of this work. You could actually be contributing to public representations of this work. I think back to my own work for the Centers for Disease Control and Prevention back in the 90s. And here I'm going to date myself a little bit because, and this is multiple iterations ago, a few years ago, there was a show called Beverly Hills 90210, and that was the remake of a show that had existed in the mid 90s. Well, in the mid 90s, I actually, when I was at CDC, worked on some scripts for the Beverly Hills 90210 original show as they had some cancer related bylines. And there are lots of examples of partnerships like that in which when you're involved in that, you sort of realize some of the constraints that Hollywood's facing, some of the constraints that scientists are facing, and how can you negotiate that and try to come up with credible or plausible representations of work. It's also the case that I think we need to have engagement with scientists increasingly if we are going to counter the challenge of misinformation. I'm going to talk about a particular specific perspective on misinformation here in a minute that's really rooted in some of these ideas, though, and it's maybe a little bit different than some of the approaches that you've heard about more prominently recently. And I'll get to that here in just a minute. But I think that what's crucial for us to recognize is that many of us are familiar with doing peer-reviewed journal article writing, submitting grants. And how is it then we can take some of that work and turn to our partnerships with the popular press or to popularly oriented books? And this is work that I've had, again, talking about that topic of misinformation, I've had a fair amount of opportunity to do that recently as we turn some of the empirical work we've done on misinformation prevalence and correction of misinformation towards the kind of practical discussion that you might think about having with various journalists about this. And this isn't necessarily always the easiest thing to do because often you've got journalists with a story written already when they come to you for a confirmatory quote, and it's sometimes a matter of patient discussion to attempt to reshape perhaps how they're even thinking about it. And that said, it's also the case that we often have academic researchers who really are hesitant to sort of engage publicly with their work for fear of being misquoted or because they think that there is a tremendous amount of nuance that their original peer review article contained that couldn't possibly make its way into a simplified USA Today story. But the problem is if you turn away from that opportunity, then somebody else is likely to fill that void and maybe won't do it as well as you could have. So I want to invite you to think about ways that you can contribute here. Here, I thought was a good opportunity for me to speak to you as a fellow researcher, but also speak to you as somebody who interviews researchers. And so Heather mentioned that I host a public radio show, which we've done for about 8 years now, called The Measure of Everyday Life. And this was a public radio show that's intentionally exists as a forum for social scientists to share their work, in a popular format. And if you're interested, in the show, you can go to our general website. You can find it at measureradio.net. You click a link there to listen. You can also find us on all kinds of podcast apps, every iTunes, Spotify, and lots of other places. So if you just search for The Measure of Everyday Life, you'll find us on Audible and other places too. But here, I wanted to offer just a few thoughts that really come from some of the coaching that I've given to guests beforehand. And I think that this is generally a good way to approach work that you might have to in offering your work in translation and interview, or thinking about something that's going to be community facing. And so I often encourage folks that are part of the show to think about the interview as a dinner conversation. That's a good, respectful, concise sort of tone that you normally would take. You're not going to necessarily go on for 2 hours, about your work if you're having dinner with the people that you sort of know. But you're going to offer some degree of technical detail to explain, but you're also going to be putting it in a larger context to relate to them. And I think it's important here to realize that there is a role and an interest in you speaking as a human being. And that's something that we invite, folks who come on our show to do. We know that audiences connect with and are interested in, the human voice behind a lot of this research. And we often, speak in a more passive third person, formalized way, in some of the submissions, and work that we do. But here's a place to embrace an I pronoun or a we pronoun once in a while, and it's okay to do that. Being specific is not necessarily boring, and actually specific can be quite compelling. I think about some of the stories people tell about their research and helping to bring it to life by talking about the specific location in the forest where you did this work, or about what the hospital board looked like, and all of that can be help to bring it to life for people. And so not being afraid to be specific in detail, but not necessarily specific with lots of jargon or language people aren't going to understand. The level of enthusiasm and curiosity that you express also matters. And here's a spot where I'd invite you to think about that as well. But at the same time, this is something I often gently point out to our guests. If you feel like you're going on and on and on and on about a topic, just like you would at dinner, chances are you could realize that you probably are. That in fact, if you feel like you're being, boring and droning on, that perhaps it's an opportunity for you to pause and think about what the interviewer might, want to ask next, but also pause and reflect and think and orient yourself towards the audience, as well. Okay, so with all that in mind, then I think we can think about some institutional efforts that we can make to actually translate and improve on public discourse. And I want to talk about a couple of examples here, and then open up the floor for your experiences. But one is actually so on point that I wanted to mention this directly. We actually pulled together a forum a few years ago, just prior to the pandemic unfolding, that was called Building and Maintaining Trust in Science. And we actually brought together leaders from nonprofits and foundations and various institutions to come together and talk about what they've learned, and to generate some ideas. And we published a white paper on this that you can find at the link there below, through RTI Press. And it's not the most complex set of insights you'd ever imagine, but these are ones that I think sometimes get overlooked. That open science and transparency is important in lots of ways. We are going to need to equip audiences to come along with us in this journey, and so encouraging critical thinking is important. But at the same time, scientists themselves are part of the discussion here, and we've got to educate them to become better communicators. That was something that was emphasized time and time again. But then the third piece was that institutional collaboration is really key. We were talking about misinformation as a particular threat, and misinformation is not a topic that you're going to be able to address entirely on your own as a single institution, because it's a part of the larger information environment. So we need institutional collaboration, like you model there, with the work that Heather and her team engage in building networks. But just generally, I think institutional collaboration and team science is going to be the name of the game when it comes to translational work as well. And we know that this is true for a lot of the work that we do. So let me just quickly touch on this example of misinformation here, because I think this is something that's sometimes of interest to people. This has been a hot topic. The Surgeon General announced recently that they were going to think about addressing this head on, and it issued an advisory. And that work was notable for both sounding the alarm, but then also pointing to particular types of remedy. And I'll point out one of these, actually one of our projects that was cited in this report here a little bit later. But in a nutshell, I think that our approach to misinformation really can benefit from this audience orientation that I've been emphasizing throughout my remarks here. I think we need to do a much better job of encouraging compassion and not necessarily shaming and blaming. I think that we have to embrace the translational opportunities we have, but to actually go ahead and do that, we've got to put money and resources behind people having job titles, with this in their title. We've got to do a better job of actually figuring out what people are encountering in the wider information environment. And this means, setting aside institutional resources for figuring out, doing Google searches and figuring out what people are finding online and monitoring information environments and scraping for that environment, for insights, even though sometimes we want to hold our nose as we think about what we might encounter in terms of the misinformation, for example, that's out there. We've got to know it, though, because this is what our audiences are going to encounter. And I also think that we could do more to empower individuals to be seekers of information. And now what you see is not on my list is a whole lot of A, shaming or blaming, or B, just the kind of myth busting work, which I think has a role, but I don't think this is about just correcting misinformation, somehow trying to vanquish it from the internet, but rather trying to build up trusted relationships with people where we can guide them through information environments. So again, this is actually related to some of the relationship building that I think needs to happen. This has been interesting for me as I've been invited to do lots of talks and work and consultation with regards to misinformation. A few years ago, also before the pandemic, I was invited by the European Consortium for Science Museum Professionals. It goes by the acronym XSite. And they really were interested in going toe-to-toe with misinformation. They saw this as a vital threat to science museums all over the continent. And what we encouraged them to do is actually reflected in the eventual title of the workshop here was to move beyond fact-checking, to think about addressing misinformation by embracing the relationships that you can build with audiences rather than necessarily worrying about going to war with misinformation per se. Now, that's not the right metaphor in our mind. We also see this in clinical contexts. Here in the U.S., I've done some work to survey licensed practitioners in the state of North Carolina, for example, about their experiences with misinformation. And part of what we found was that the vast majority of licensed practitioners in North Carolina, more than 90% of them, regularly were encountering patients who were referring to misinformation. At the same time, most people had no formal training as to what to do about that. Less than a fifth of survey respondents had ever had a course or training in what to do about patient misinformation. So there's a need here for supporting some of our clinical practitioners. And so what we have done is develop a workshop and a training here. Initially started out as an in-person workshop. We quickly needed to pivot and make this into a virtual workshop, which we've done now through the Duke program on medical misinformation. There's a URL there to read more about what we're doing, but in short, we're offering training to licensed practitioners. And as we do this, there are some resonant themes with the talk I've been offering here for you. And that we encourage people to think about patient psychology. We encourage them to think about the information environment as it exists right now, and especially in a place like the United States. And we also encourage them to recognize that all of us as human beings are actually vulnerable to misinformation. That if we're going to make headway at all on this, that we've got to start from a stance of empathy and compassion. And this is not unlike my encouragement early in this beginning of this talk to say that we ought to be rooted in and be thinking about what the mental models people are bringing to bear. Similarly, here we've got to recognize that all of us actually, under certain circumstances, process misinformation as information, to start. And while it's the case that people can critically engage it, it nonetheless our default stance is to actually accept it at face value, and that's part of the explanation for why we are where we are. But along the way, I like to raise the example of a woman by the name of Belle Gibson. And Belle Gibson is an interesting story because there are lots of dimensions. If I'm giving a talk on misinformation and I mentioned the story of Belle Gibson, there's a really important ethical concern, that I could raise, because Belle Gibson was a social media influencer. She's somebody who rose to fame by virtue of some of what she was offering as supposed cures for cancer through nutritional means. Just note that euphemistically. But there's a real problem with the Belle Gibson story, and the story is that she's offering all this information about how she overcame her own cancer through nutritional means, when in fact she actually never had cancer and she was a fraud. And so, as I said, there's a lot that you could be worried or concerned about in terms of the Belle Gibson story, in terms of her own fraud. And from an ethical standpoint, there's a lot you might worry about. But why I think the Belle Gibson story is important for us is that it says something really important about the audiences that we seek to engage. There were reasons why the Belle Gibson became famous. And part of it was that she was telling a story of hope. She was offering hope in the face of a devastating disease. And while it turned out to not be true, nonetheless, there was something attractive in what she was offering. And that story of hope, I think, is important for us to pay attention to. As human beings, we all need social connection. We've learned that more than ever before during the pandemic. We also need hope for the future. And if we're in a situation where we don't have either of those things, we can expect that misinformation and other problematic information is going to diffuse widely if it offers either of those things. If it offers you something to talk to your neighbor about, if it offers you some reason to be hopeful about the future, then it's something you might be attracted to. And so part of the challenge for us is to think about how we can take the information that we have and to cast it in terms of those in those terms. What can we offer that might be useful for people's neighbors? What can we offer that might actually be hopeful for them? Because that basic, human interest in all of that is not going anywhere anytime soon. And so the quicker we can realize that, I think the better. Okay, so I promised to turn the attention back to you all. Here I want to, and there are different ways you could engage with this, and we can put this into the chat, or you could also raise a hand. I can back out of the slides here and talk about this, but I'm interested to know what some of the experiences you've had with translating your work, and what some of the challenges have been, what some of the reasons why this hasn't necessarily gone particularly well. I see here that we've got at least one comment in the Q&A, so I'm going to start with that, and then I'll also look at the chat, and then I'll turn it back to Heather as well. But let me first go to the first question that we had already come in. This is from Sharmat Mustafa. And the question was, where do you start when it comes to building trust and encouraging involvement in clinical research with disadvantaged and or underserved communities? This is a fantastic question. And I really appreciate that you raised this. This speaks to some of the work that I've been involved with. Recently, we're doing some work at RTI with the All of Us initiative for NIH. I was also been involved in some discussions with the Heal initiative for NIH and other efforts. And I think part of what we have to do here is really think about and check some of the assumptions that we might make. So I'll speak candidly here in a way that I hope is really respectful and enthusiastic for all the good that we can do. But I also think that some of the conversations that we have about reaching disadvantaged audiences, reaching underserved communities, some of that work is rooted in assumptions that I'm not sure is entirely fair. And I think it's well-intentioned work, but I think that sometimes people are not recognizing sort of the key and most fundamental assumption that we probably need to make about various communities is that people want to be healthy, and they want to keep their families healthy, and that is a driving motivation as they try to make their way through. And instead, sometimes what we do is think about various references to historical incidents, which may well have translated, may well be part of discourse in different ways, but I'm not sure are as top of the mind or as salient for people as we sometimes assume. So a good example of this is assuming, for example, vaccine hesitancy or lack of vaccine acceptance purely on the basis of, for lack of a better way of referring to this, the Tuskegee incident, for example, or thinking about reference to various historical examples, when in fact the structural racism that we face in today's world, and the lack of resources, the constraints of people, that is much a driving factor. But I think there's sometimes embedded in people's initial assumption is that there is a resistance or a reference to other your reference points that may or may not actually be particularly salient. So I think it's important to try to find out what is salient for people currently, find ways to invite people into the process, and to assume that no amount of that is ever going to necessarily be too much. I think that there's something really important. And then we've also got a comment here from Heather with regards to that. So Heather, I want to invite you back in, and then I'm going to also look at the next question. Yeah.
Yeah, so I see there's a question. So are you asking me to read your question? Sorry, there's some things coming in, so I'm trying to.
Oh, no, okay. So I'm sorry, on the chat, Charmot's question that I just answered, I got a note that said Heather Gilmartin would like to answer this question live. So I didn't know.
Oh, I apologize. No, I'm still working the system. So you keep going. You're doing great.
Great. Okay. So then it might have been that you had clicked there. So I'm going to then move on to Miriam's next question here, which is that the question is, how do you teach or convey the concepts of translational research to graduate students in academic settings? And so this is a really important question, because I think sometimes we've got graduate students who are really eager to do the work of publishing publishing papers. They're getting socialized and understanding what's necessary. They become accustomed to critiquing each other's work and to getting ready for peer reviewers and grant reviewers and all of that. And they lose sight of, or haven't had much experience with, then translating this for external audiences. And so I think that can be a challenge, but there are built in on some level, typically opportunities, small scale opportunities for those graduate students in the way and form of their extended networks, family members and others. Might think about framing some of this conversation in terms of how people would explain X or Y concept to their aunt or uncle at Thanksgiving dinner, and it's not going to completely solve the solution, but to help people recognize who are some of the known people that maybe outside of this particular formal setting, who you can think about doing that translational work for. And I think that's something that because it can be hard for people to sort of understand this in the abstract, and I think that's part of the insight in your question there, which is that we don't want to assume that graduate students themselves have had necessarily a lot of experience with this. I think some of this is a matter of being willing to write work for public audiences that you also accept feedback on also. And so finding ways and allowing for graduate students where it's safe and easy to do so, to be a part of public facing events and trying to understand what the actual questions are that get raised. That can be important, I think. So Nikki has a question here about Nikki. So we could spend a lot of time in a much longer talk about misinformation here, but you raised a question about who decides what's correct versus misinformation. They're a high-level independent committee or board, free of conflicts, that's responsible for establishing what's true or false, and then communicating this to the medical community and the public. What's the system that exists? And unfortunately, this is you're raising a great question. This is a question of continuing debate. But I want to offer an approach here to thinking about misinformation, which is going to, I think, align with the spirit of your question, while not answer it definitively, because it's something that has to be negotiated in particular cases. I tend to think about misinformation not entirely in terms of absolute truth or falsehood per se, but rather to think about it in terms of relationships between institutions and communities, because we are all, those of us that are doing scientific research, peer reviewed research, have decided to play by rules in publishing that work, and we think that that's the best way of generating knowledge. It seemed to have worked out pretty well. But we have to recognize that what we're talking about when we talk about scientific misinformation is that we're actually talking about work that is outside of the bounds of those rules. And that means that there's a certain degree of academic experts worrying about others not listening to them. And I think that bleeds over into a larger attitude that's not always warranted. And so if you think about, there is work for which there is consensus, and there is work for which, or ideas for which there is empirical evidence. But it may not necessarily always be, the opinions of academic experts, or that there's a canon of knowledge. You're talking about people that are operating outside of that, but we've got to realize, with all due humility, that even that canon of knowledge gets updated sometimes. It's the nature of research. Science is iterative, and I think we've got to be transparent about that. Personally, I think that one of the biggest steps forward we could make in terms of building trust in science is not necessarily to start with large-scale fact-finding and fact correction efforts, but rather to open the doors a little bit more and to be more transparent about this whole process of science. Because I think that part of the challenge we face in terms of public understanding of science is a lack of understanding of the process of science. But I think that people would recognize that there's trial and error. There's room for mistakes, but those can be corrected. But I think that we would instill a lot more trust if we open the door to recognize this is the extensive, rigorous process that we often go through in trying to reach these different conclusions. So I think it's a process of awareness rather than necessarily a factual awareness, which is the bigger challenge. But that said, I've been part of discussions. I've talked with various social media platforms. I've talked with various government agencies, and I think that attempting to do what you're doing in correcting misinformation in the interest of wider public good, you probably need to be somewhat narrow in your scope there. There are instances in which there are things for which we have well-established evidence. We can point to that. And it's instances when we can't, then we should say we don't know. And that's something that, but here's our process for understanding it. We've had an awful lot of opportunity for that during the pandemic, and the messaging hasn't always gone well. And I think that, so here I would emphasize transparency, and I'd emphasize how we know what we know. And I think that's a good starting place. But I think that, Nikki, your question goes to the heart of part of the reason why some, people outside of scientific institutions have a problem with some of the efforts, because it feels like people looking down their nose and just saying, well, I know because I'm the expert. And we don't always have room and time to offer the full 1,000-page report as to how we got to reach a particular conclusion, where we probably could do a better job of educating and providing some transparency as to how it is that we reached some of the conclusions that we did generally. So okay. Heather, I'm going to open the chat here. And it looks like we've got a couple of
I think you've actually addressed Nikki's question, but I have a question for you, if I may.
Great. Oh, so absolutely. Yeah.
We work within institutions, right? We work within university settings, sometimes for-profit, not-for-profit, sometimes the government. So what should we do if we're speaking on behalf of potentially our institution?
Yeah, that's a challenging question here, and I think that I think a healthy future would be one in which people are allowed to both represent and to acknowledge their own human individual perspective. But I think that I think the probably most important thing you can do is to acknowledge the constraint or the extent to which you are or aren't speaking for an institution. So we're used to that kind of disclaimer. Sometimes people are being interviewed, but I also think that it requires some degree of checking in, and we have to think about the internal communication that does or doesn't happen sometimes. As to what is it we're attempting to say here, and to what extent does that reflect what our various constituencies or audiences want to hear. And so sometimes you're going to need to be an ambassador internally as to what ought to be said. In terms of also thinking about that. But that's, I think just letting people know, here's the basis for which, here's the perspective I'm offering, here's the authority that I have to speak, for the larger institution or not. People will appreciate that, generally. But, the truth is institutions are partly comprised of people, or they comprise people. And so, that's important here too. A lot of the decisions that we've heard about were ones that were made by individuals. I've got an anonymous attendee with a question. So just looking at the clock, I know we're almost out of time. I'm just going to try to get to that one, and then Heather, I'll come back out to you. We've got a larger question here about how society should balance freedom of speech rights against harmful misinformation, in terms of the equivalent of shouting fire in a crowded movie theater in the era of social media. And here, I am going to note that I don't think all misinformation is equal. And I think that we would probably do more harm than good if we were in a situation where we tried to vanquish all, conceivable misinformation, because we might come close to a situation of censorship, which would be really problematic for us. I think that instead, I'm somewhat of the mind that if we can do a better job of holding the hand of our audience and navigating them through a problematic information environment, that might be more important than attempting to vanquish the misinformation that's out there. The metaphor that always comes to mind for me is the old carnival game of whack-a-mole, because you're constantly going to be having to try to do that. And I think that instead, if you can probably do a good job of getting an audience to come back to you when they have a question, to ask for your advice, and that's probably where we ought to be. I think that, generally speaking, there are things, though, that if it's a situation of life and death and people are going to be acting on that information in an irreversible way, then I think government officials and others have a responsibility to not say things that are false that might lead to that. And so that's something that I do think that from an ethical standpoint, you can think about the immediate consequence and the short term and the irreversible consequence of certain types of information that probably ought to be avoided, from an ethical standpoint. But that's a far cry from necessarily attempting to sanitize the wider information environment from all misinformation. So I've been talking quickly here, kind of belying my own New York roots, here a little bit, but there's a lot of information. These is great, comments. If you want to talk further, I'm happy to follow up, either on LinkedIn, where you can find me, or at either of these email addresses. But I'm going to stop my sharing here to come back out to Heather to see if there are any other last minute comments, here. I think we've got actually, maybe I was a little bit off in my time. We've got some more time here, all right? So we actually, yeah, I'm sorry.
We do. Yeah, we have a couple more minutes, and we'll
Yep.
let people out, a couple minutes early, so we don't have back-to-back Zoom meetings. But we have another great question from Charmant, and she's asking, what are some strategies for bridging the clinical research language gap between researchers and non-researchers, their audiences? So, the general public, and involving underrepresented communities as contributing partners to advance scientific breakthroughs and medical breakthroughs in medicines and vaccines.
Yeah, so this is, and I'm glad we've actually got more time. I was going on the timer on on Zoom, but we logged on early, so that's why. And so, I think that understanding, there a lot of this gets placed under the heading of various literacies that we might think about. Might think about, health literacy and understanding of health-related concepts. We can think about digital literacy and ways in which people are engaging with different tools. And we can also think, just from a vocabulary standpoint. And I think that in my mind, it's important to realize that just because somebody doesn't have a particular vocabulary word in mind doesn't mean that they're not capable of understanding the concept. And so we've got to think about this from an educational standpoint. What are ways, and then sometimes there's challenges here because specific scientific language often is developed for a particular reason, to capture a concept, and it's not the same. It's apples and oranges when you explain it in terms of something else. But you have to think about whether it's worth the trade-off, there. And here's the spot where I think that part of what we've got to do is to think about what could be done before we're having the conversation in question. What could be done in advance to kind of prepare groups for talking with each other. I think that sometimes we assume that the onus is necessarily just on the external underserved group, but there's more that we could be doing to understand different concepts in that group and language as well. And so I think part of it is a matter of relationship building and trust that happens, hopefully years before the pandemic, rather than in the midst of it, right? And so that's, and it's easier to say that than do it, but I think that, this is good justification for why, it makes sense for you to do listening to our work, now, even before you have a research to relay. And I think also something that is really important here is to realize that there are questions that should be asked before you start framing your presentation of research that have to do with the values and interests of the audience. What is it people value? What is it they might be interested in? And that can help you shape how you're going to present things. And so it may be that there are dimensions of a particular concept which it's not important if somebody necessarily grasps this dimension of nuance, when what really matters to them is some other larger piece. But you would only know that by knowing what the community values beforehand. So I think that again, though, one of the strategies here is we've got lots of calls for community engagement and community participation in research, and lots of say, well, we've got to involve stakeholders and all that, but what does that really mean? And I think one of the problems and challenges with participatory research sort of in general is that it's tough to necessarily, you need some level of organization in order for that to move forward. In rhetoric, there's this old concept of stasis, which is really a challenge for a lot of debate or discussion, because it's just this notion that you've got to both be talking about the same thing or the same point in order to be able to move on from it, and there has to be some level of coincidence on that point. And similarly, I think that there is a role for moderation, there is a role for organization. And so even if you are opening the door to inviting community members in and to talking about it, still needs to be guided and organized, and moderated. So just like you would do with a radio interview, I think a good host is one that makes herself or himself invisible on some level, but somehow the conversation goes to the various places that the audience wants it, the questions that they might have, but you think really hard and seriously about the questions that you might raise. So I think that's important. I just, again, though, this goes back to some of the base assumptions that we have, and I worry that sometimes for all of the work that we're emphasizing here, which would emphasize communication, education, and information, we also have to realize that the structure of our society has led to these structural inequities that have led to certain communities being outside, being underrepresented, being underserved, and that that has to be the sort of starting place, I think, from this, because and in my mind it makes the challenge both harder and easier, because you realize, well, there's just been inequity, and even the starting positions of some of the communities in some of these discussions, there are these structural reasons why they aren't sort of engaged in research. But it also means that some of the assumptions that we have about how impossible that might be, or how resistant people are going to be, that those are wrong placed. And so I think a lot of the times I've heard this quite a bit in terms of trying to diversify clinical trials, for example. A lot of people that enroll, they say the biggest step forward was just somebody asking them. And I know that might sound overly simplistic, but I think that just recognizing that we've got to do a better job of physically advertising and reaching out, and what's the communication infrastructure we have for actually reaching people. This is something that's come up a lot in discussions. I don't mean to keep raising pandemic level pandemic examples, but that's been top of the mind for me with a lot of the media interviews I've done. And for my, I think it's fair to say many of us probably are feeling, a couple of years, into the pandemic, the issue and topic of vaccines, like how could we possibly have any more information about that than we do, the sense that like, oh, everybody is out there, that everybody knows, people are making decisions, and I think that alone has been a tragic example in my mind of something that people have misunderstood about our society generally, which is even a couple of years in, there are still lots of people that have been spending a lot of time simply trying to find ways to put food on the table, taking care of kids, managing, and they have a general sense that we've been through something. But I don't think it's fair to suggest that most people have necessarily access to or have time or resources to be reading or listening to all the information that all of our clinical experts have, even after something so widespread as this. And so I tend to, a good example of this was a couple of years ago. I was doing some work on a project at Duke University, and this was a project intended to reach residents in low-income housing communities, with energy conservation information. The worry and concern was that a lot of these, apartments were places where there was a lot of, inefficiency in energy use, and there's a major concern about that. So people put together, this free workshop, and weren't getting people to sign up. And so we actually did a research project, actually going to another place where people were signing up for heating and assistance, and a place where people were going to be. And so we actually did a lot of interviews and did some survey work. And by and large, the single biggest reason why people weren't going to this free workshop wasn't a lack of interest in the environment. It wasn't a lack of interest in saving money. It wasn't a lack of it was simply structurally getting to the location, or it wasn't offered virtually, and just the challenges people had in terms of transportation or childcare or other things like that. So just the burdens of being poor, like all the both. That's something that I think we tend to not see. So I think keeping that in mind can also be really important here. So, yeah.
Well, that's a lovely way to end this. This was a really interesting, comprehensive talk. I think I feel energized. I'm going to go do something different, try and engage. But I love that it comes back to being a human being and having relationships. So thank you so much for your time. We will invite you back soon.
Oh, and Heather, you're either muted or my audio broke out. Yeah. If you can you hear me? Oh, there you go.
Sorry, my internet.
Okay.
Anyway, any final remarks, Dr. Southwell?
No, other than just thank you for putting a topic like this on your list of things to emphasize, and I'd be happy to follow up if any of what I alluded to kind of quickly going through everything. If it would be useful, just have people email me. I'd be happy to send links. But good luck to all the work that you're doing. But just even being sensitive to some of these ideas is a great first step for all this. So thank you very much.
Thank you. And we will be posting this recording to our website at CCTSI so that you can share it with others, since we know it's hard to fit these things in. So thank you again, and everyone have a fantastic Monday.
Thank you.